Good. So, Kraig, you'd mentioned, I think on the podcast and maybe in your remarks at the Pioneer conference about the investment that RedSail's putting into Pioneer. So, one of the areas that you also talked about at the Pioneer conference was medical billing.
Yep.
You just made an acquisition a couple months
ago
on medical billing. Tell us more about that. Medical billing is such an important part and a growing important part for independents. How are you making it easy for independents to bill on the medical side?
Yeah, so the first thing, we purchased TransactRx, and TransactRx is known for providing physician offices access to pharmacy billing for scripts. What a lot of folks didn't realize is they built that platform from the ground up in the cloud and really got their start in medical billing for pharmacies. And so they had a lot of that capability, but for business focused reasons as a small company, they're focusing more on physician practice offices. We particularly liked the scalability and configurability of the platform, and because of how they architected it. And as a result, believe that we can integrate it more, because what you've been missing is something that's truly integrated and automated within the pharmacy management system. So you'll see in the coming months some iterations that we're doing within the Pioneer system to not only automate the documentation in the front end, but also to try to close the black hole of reconciliation with a lot of the medical billing functionality on the back end. And so you'll see that coming out fairly rapidly over the next 60, 90 days with the first revs. And then what we'll do is continue to build out the rules engine for the actual medical billing procedures. We'll be the first to say that the iteration 1 with TransactRx is really vaccine billing. And now we're going to spend the next 4 months billing out the rest of the ICD codes with it. But it's a dramatically more configurable solution and helps us answer the real big problem we felt, which is it's expensive to get into it. And we're trying to solve that problem. So take away some of the upfront investment in workload and time by automating some of that, and then truly embedding it into the workflow. And so we're doing that work right now. And so it's out in quite a few Pioneer sites, but we'll really start launching that in earnest as vaccine season's starting to roll out. Jeff, anything you want to add to that?
No, that was I think to emphasize there that TransactRx had done DME billing for pharmacy and other medical billing for pharmacy in the past, and just based on business decision and what was most profitable, they had focused on vaccinations, especially during the pandemic. And so those will be services they'll be able to turn back on very rapidly. So it was a really good ability to invest in a company that was small enough you didn't have to pay a whole lot, but they had really good core technology to build upon. And I
mean, our theme, whether it be medical billing or pharmacy-based billing, we re-architected Powerline. Powerline's now up in the cloud. It's brand new architecture. Our view of the whole industry around the billing side, whether it be medical or pharmacy, is that pharmacists and pharmacies having to rely on literally code that was written 30 years ago. And as we were looking around the market, Transact was the one that we thought was the most compelling as it comes to an architecture for the future. And so we see those two technologies merging from a rules engine standpoint, and then integrating more deeply into pharmacy workflow with Pioneer.